Hello, my name is Pallavi Ahir, and I am a volunteer for Girl Up Brampton. I'm from Brampton, Ontario, Canada, and currently am a full-time high school student. I decided to volunteer with Girl Up Brampton to help create positive change in my community so that I could contribute to creating a more equal world. The topic that I will be talking about today is how to take care of reproductive regions. I will be discussing in general what the reproductive regions are and what they do, and specifically, I will talk about how to take care of the reproductive regions. So, what are the reproductive regions of a woman? Reproductive regions in a woman's body are the areas involved in producing offspring. These regions should be taken good care of as they are very delicate and important parts of a female's body. Taking care of these regions can ensure good health and protection against infections and possible long-term health conditions. Not taking care of these regions can put your health at risk, resulting in the development of many reproductive disorders, an example being uterine fibroids, which can cause non-conscious tumors in the body and have symptoms that many people say they cannot feel. We'll start by discussing the internal regions in the reproductive system. Ovaries are oval-shaped organs that are on both sides of the upper uterus. The purpose of ovaries is to create, preserve, and release eggs into the uterine tubes whilst in the process of ovulation. Next, the uterus is a part of the reproductive system that has many strong muscles that expand and contract to allow more space for a growing fetus. These muscles are also used to push out a child during labor in pregnancy. The uterus, however, does not dilate when a female is not pregnant. The cervix is the lower part of the uterus. Its purpose is to keep bacteria out of the uterus, as bacteria could cause infections if not kept out. It also produces discharge, which cleans the vagina, as well as it is positioned in such a way that can help protect a pregnancy. Uterine tubes, also known as fallopian tubes, purpose is to push the eggs transported by the ovaries toward the uterus. These tubes join the uterus to the ovaries. The last internal region that we will be talking about is the vagina, which is a hollow muscular tube that exists through the vaginal opening to the uterus. The vagina has many purposes. It is where the penis is inserted during sexual intercourse, where the baby leaves a woman's body in childbirth, and the route for menstrual blood to leave the body. The muscular walls of this organ allow it to expand and contract. Mucous membranes are lined on the walls of the vagina to help it remain moist and protected. Now we'll go over the external regions. The vulva is made up of three parts: the clitoris, which is a sensory organ, and the folds of the labia, the labium minus and the labium majus. The vulva is located between the legs and covers the vagina's opening and other internal reproductive organs. The labia are a pair of skin flaps around the vaginal opening. When girls reach sexual maturity, the outer labia and mons pubis, which is the area above the vaginal opening, become covered by pubic hair. How should one take care of their reproductive regions? General health care. Taking care of your general health is important for taking care of the reproductive regions. Some of the things you can do are eat healthy, maintain a healthy weight for your age and height, and exercise often. Maintaining good overall health can help reduce the chances of developing chronic conditions that may increase the likeliness of contracting yeast and urinary tract infections, which are conditions relating to poor maintenance of overall health and reproductive regions. Vulva care. To take care of your external reproductive region specifically, there are some things that you should avoid and some things that you should practice. A good practice to clean the vulva, which is a main external region, is to use warm water while washing it and dry it with a clean towel. You should avoid products such as douches, wipes, and harsh chemicals. These products can interfere with the natural balance of the organ. You shouldn't use these unless prescribed by a medical professional. The vagina is a self-cleaning organ that cleans itself naturally with vaginal discharge, which is a clear or white substance. Due to it having a natural cleaning function, there is typically no need to use many products to take care of it. Also, to avoid irritation around the vulva, you should also avoid products like feminine spray, deodorant, scented oils, and powder. You should also avoid wearing underwear made of materials like nylon, acetate, or other human-made fibers if you have sensitive or easily irritable skin. Instead, try to wear 100% cotton underwear or underwear made of less irritating fabrics. Lastly, avoid wearing nylon pantyhose or tight-fitted leggings, as they may trap moisture and heat. These conditions can create an environment for breeding unwanted organisms such as bacteria. That is all for the lesson of how to take care of reproductive regions. In this lesson, we learned some of the organs in the reproductive regions and their function, and also how we can take care of these regions to avoid getting infections and diseases. Thank you for watching and listening. Bye!